Nigeria seem to have been making plans for many years now to ensure equity and access to all when it comes to universal health, just so that you and I, without any encumbrances, can access healthcare. How can we achieve that? And we have the 30th anniversary conversation that we'll be having, speaking about financing for this universal healthcare that we keep talking about. Promises to be interesting, so stay tuned. In the studio to discuss all of that is Dr. Ufuoma Omo-Obi. I hope I got that right. Omo-Obi.
You attempted to get it right.
Dr. Ufuoma Omo-Obi. Okay, he's the regional director of West Central Africa Options Consultancy. Thank you for being part of the program.
Thank you very much.
Yes.
Good morning, and then welcome to ASO Morning. Universal healthcare. It's as old as I am, because I know it's something that we always hear about. We've been talking about it, and if you're talking about the Sustainable Development Goals, it's expected that by 2030, there should be sufficient universal health goals achieved around the world. Now let's look at it in Nigeria. Put it in context, and when you put it in context, you're looking at our health sector. We agree that our health sector needs their intervention. When you're looking at the primary health sector, you're looking at primary health care, and then secondary health care, all those kind of health care. Every aspect of our health care is in comatose, if I ask words. Well, or near comatose, because there are people that are complaining about, adequate health care that is very inexpensive. When we're looking at universal health coverage for Nigerians, what exactly is our focus? What should we be expecting from the government when we're talking about that healthcare coverage?
Thank you very much. I will first of all say that we're in a very good place at the moment. When I say we're in a very good place, is there's nothing as great as having the right leadership in place and the right body language, as they say it, right? Because it helps to really determine where we go with our visions, our ambitions, and our aspirations as a people.
Okay.
So I think this is the time for Nigeria and for Nigerians when we talk about universal health coverage, because I would say that in the last administration, some deliberate actions were taken that placed Nigerians as a priority, and we believe, those of us in the health sector believe that if we all work together, then, with the renewed hope agenda of Mr. President and the current Minister of Health, the special advisor to the President on Health, those of us that are actors in the health space, and you said something which is very important, and I think this is where the rubber touches the road for us as Nigerians. Health is not an issue of the healthcare sector alone.
I agree with that.
Okay, and that is where we really need to open up this space for a lot of actors and a lot of collaborators and stakeholders to come in. Health is a multi-sectoral agenda. It includes, let me use this when the words of Professor Ladipo last week was like, one thing we have missed or we are missing is mass. When I mean mass, when you talk about universal health coverage, it's about all. Now, how much of health information and education does everybody in Nigeria have in terms of access, in terms of information, availability of services, and also ability to demand for services? So when we talk about universal health coverage, we're talking about multi-sectorial, multi-stakeholder, multi-people approach to addressing that agenda. And that is my first call. And that is one of the calls, I would say that got to me personally as we celebrated our options, 30th anniversary with the team from vision to reality. We've been talking, like you said, we've been talking about
it forever.
So yes, this is the time. That's why I say this is the best time. From vision to reality, unlocking universal health coverage and health prosperity. This is the time we need to talk about health prosperity, where healthcare and access to healthcare is not a chore where you do not, as part of your earnings every month, you don't allocate as an individual money for people at home, or out of pocket expenditure that you need to, make those transfers to for people, because they have access to care. So we would tackle the problem of healthcare. And the beauty of it is that data has shown, when you tackle the issue of healthcare and access to healthcare, you open up a world of opportunity for productivity, economic transformation, social transformation, and you will see that the sine qua non, there's a direct relationship between health outcomes and economic prosperity. If you go into population dynamics, we talk about demographic dividend. When you have a productive population, you tend to have more wealth. And it's true. Look at other parts of the world where there is a lot of wealth. You see that the population is dynamic.
But all these things sound like an Ethiopian idea. We all know that health is wealth. Simple language, and we know that a healthy society is a wealthy society. But the harsh realities on ground doesn't make one look at that universal health coverage. I know the government has tried to do, the national health health schemes. I know several states, the FCT has its FCT health care schemes. Other states have their own insurance health schemes, and they've tried to not just limit it to the public sector, but you also see private individuals, making certain donations to the state every week, every month. They pay some stipends to get good health care. But the reality that is on ground, this administration is still relatively new, about 2-3 months old, so we're still looking and waiting. And of course the minister just came in about 2 weeks ago, so we're still waiting to see them run to the direction that we expect. The reality is that healthcare in Nigeria, when it's very good, is most times unaffordable. So you're looking at going to a private hospital because you want to get very good medical care. But sometimes when you go to the public hospitals, the tertiary care, the primary health centers, the government-owned hospitals, you don't find right staffing. The doctors are overwhelmed by the number of patients they have to deal with. There are no drugs. You have to go and buy drugs outside because they wouldn't give you, even when you're on health coverage. So what you're saying is what it should be. Then we're also looking at doctors underpaid, medical personnel underpaid. You're looking at citizens, they're not going on strike. How can we get this, like you said, from dream to reality? What should the government be doing, Tinubu's administration to be doing, to get health care as a #1 priority in the country?
Thank you very much. So I would say that that's where we need to move from vision to reality. The last administration did pass the National Health Insurance Act.
Yes.
And reorganized, the National Health Insurance Scheme to become a National Health Insurance Agency. And that is one big move. Now, and the thing is for Nigerians to take it up. Right? So there's an upstream level of work which is setting the policy framing and the policy tone for this to happen. And it's for Nigerians, like I said, all the stakeholders and all the actors to take this on, which is where the rubber touches the road. Yes, there are those determinants that you just mentioned, like quality of care, human resources for health. We are having to deal with the Jackpa thing.
Exactly. And the medical sector is most affected.
And those are some of the critical issues that we're talking about dealing with, where the National Health Insurance Act is in place. It's for Nigerians to embrace it. My question I will ask is that when you seek for health care, where do you go to? For care? What's your mindset? Because there's also that paradigm shift we need to make, that there are a lot of investment, like the last administration also, took action to make sure that there's that provision from the Consolidated Revenue Fund, the Basic Healthcare Provision Fund, which makes resources available and equitable, and also looking at vulnerable population, also making sure that there's that piece, that's available for, people who cannot afford, so there can be inclusive health and the financing work. So the truth of the matter is that there are few things that needs to be done, I would say, right? Few actions that needs to be taken, but it can't be done by the healthcare, the health system alone. And that's why one piece is accountability, the demand for accountability by Nigerians, the demand for quality services by Nigerians.
How do they demand?
By going to the facility. Your first response when you have malaria is not to go to the high-end facilities as we see. You know, you are down where
you should go to the primary health center.
Yeah.
How many health centers are functional? And that's the truth. Because I know that you shouldn't even go.
And it's not functioning.
I'm too afraid to go.
So that's, you know,
I have that perception.
You know what we said earlier
There's one around my axis. Okay. I see it. I look at the building. And in all fairness, I don't feel comfortable that I might get professionals there. I don't feel comfortable that I would get the kind of drugs that I require. And I feel, unfortunately, maybe they've put this thing there for poorer people. And it's not supposed to be so.
You see,
the primary health center is supposed to cater for everybody.
Okay.
So how do we get Nigerians out of this perception that the primary health centers are not adequate? Because would you go to a primary health center? I
would go to a primary health care, right? And I go there, right? Because I want, as part of the narrative, you know, I said something. I did mention that last week, Professor Ladipo said we need to do that. People need to be aware, right? People need to be aware of what service is available. And there are lots of investments being made in this direction. Right. BMGF is making investments in supporting primary health care. A lot of the donors, USCI, all the donors that you have in Nigeria are making investments in making sure that primary health care works. Now, if you don't go there and assess the services and see what is there and give feedback, because what we're also doing is that, like I said, we're fixing upstream and downstream. Yes, I agree basically, and that's one of the things that have been put forward last week. The communique will be out late today. Okay. You know, is there needs to be investments, you know, in critical infrastructure. And that's what I talked about. You know, it's a multi-stakeholder approach. We need the private sector in. Dr. Anna Skolo said it last week. There should be a deliberate agenda to include the private sector, and people are open. Every state is at different levels when it comes to universal healthcare and access to healthcare. It's your choice. For example, if you go to Lagos, you know, some part of the MCAs are working, right? No, it's also a function of what the people perceive, and that's why we are talking about all the ends. Voice. You know, when you go to that facility, what are you seeing? You know, for example, I know that BMGF is supporting Tracker, you know, where citizens' voice and feedback is being imputed into, you know, service delivery options that are available so that people can know. I go to this facility, I don't see a provider, I don't see whatever. There's a mechanism to put that feedback so that we can demand back to the government, say, well, you said you have put X, Y, Z, you said drug, blah, blah, blah. So what's going on here? So that interaction needs to happen. And that's what we have been doing, I would say, for a couple of years, where we look at citizens' voices, citizens' participation in healthcare governance. For example, the BACPF fund, every PHC, every ward has a PHC receiving some support from the government, you know, as part of, from the Considered Revenue Fund to function effectively. Now, if I go to that facility, am I getting care? If I'm not getting care, I should be talking about it. Somebody should be talking about it. And that's why, for example, we need you, the media, to be the voice, to go out there and look at what is working in the PHC, what's not working in the PHC. Yes, we know we need to optimize PHCs. Yes, we know we need to optimize financing. Now, the problem, like we keep saying, is that not just problem, we say, like, there's no scarcity of knowledge. There's no scarcity, I would say, of resources that are allocated for health. Do you know, we know this, right? You may know this. Check out budgets that are voted, that are pegged for healthcare year on year are not fully expended or utilized. Not because anybody there's no plan to improve healthcare, but because there's also the need to optimize the leadership and the capacity of health managers to deliver on their commitments. Yes. What are the barriers, within that fiscal space, within the public financial management space? I agree strongly with that. Inform prioritization of setting of budgetary allocations and activities as to be delivered. So I think, like we keep saying, is that this should be a total health approach. Exactly. This should be a total market approach. This is an ecosystem piece, and every one of us should be on board to make it work. If we don't have citizens really speaking out to say, listen, I went to a PHC I didn't get care and all of that, and you make it an issue, the in charge, when I get there, there's no human being there because he's doing private practice. By the time you, as media people, amplify that, the health manager, maybe at the city council, we flag that up. Maybe the commissioner will also be concerned that, you know, where he has invested resources on, he's not getting people who are doing their jobs, and he'll ask people questions. So these are the practicalities. So, you know, and that's where we say there's a lot of issues, nuanced issues about accountability end to end, you know, in the health system. I think if we fix the piece around accountability and we use evidence, and also that will also help us to now use the evidence as we are getting to improve the quality of care, you know, because by the time we know what is going on in the facility, they will know, okay, oh, we don't have a midwife here, so we don't know the reasons why there are maternal deaths here. Right. Oh, we don't have a pediatrician here, somebody who is helping us with that. That's why we have the children being born, you know, the care for children here is going like this. Then we now begin to look at how do we fix that up. But if we do not use the data that is coming, and that's what Dr. Sama said last week, we need a lot of data for decision making. We need to invest.
We've also been hearing about the Nigerian health insurance schemes trying to open up the dragnet, especially for what they call the informal sector, those who are not really structured, probably do not have government jobs and all of that. How is it going in terms of awareness?
Yeah, so there's a big move, like the NHI Act makes it mandatory
right,
for every Nigerian, whether you are every Nigerian, and if you are living in Nigeria, to compulsorily have health insurance. That's what happens all over the world. But are you on health? Maybe yes.
I am.
I am. Health insurance.
Yes.
But like you said, the people in the informal
large
sector,
number of people,
large millions of people,
yes.
and you ask the question, you know.
You'll have to wrap it up in a minute because we have to go.
Some states, for example, you know, for you to access the BACPF fund, for example, you need to, you know, pay some bit of, you need to match so you can increase the pool of people you are caring for.
Absolutely.
So if I'm a governor, I'm not interested. My priority is building roads and bridges. Or doing some other things. It
would affect your matching of funding.
If it affects of already health outcomes in your state. So there's also a call, you know, for governments that, you know, that are accountable to people to make sure the resources for health are available, fairly when they can draw down from resources like, you know, the BACPF that will make some of those provisions for people who are not able to afford to have access to health care, as it were. So there's a lot that, like I said, it's not just one person. It should be an ecosystem approach. It's a total health market approach. The private sector will do its piece. They get it right. They know what needs to be done. The public sector needs to do their piece. They know it and they know what to be done. There are barriers in the system. We need to unlock them, and that's why we're saying let's unlock this thing. We should move to health prosperity. We've been talking about UHC, like you said, for decades, and that's what came out, and that was the voice that came out collectively. Over 180 people last week in Sheraton, where we had celebrated our 30th anniversary. We brought in experts from the World Bank, from the National Primary Care Development Agency, you know, people who do voice work and accountability work and evidence work at state level, insurance, you know, state health insurance agency leads, executive secretary, and the broad stakeholders, and health economist Dr. Nkata, who chaired that session to discuss. And at the end, we articulated those issues. I said more inclusive health space. Yeah. We spoke about equitable care. We spoke about this. We need to open up, you know, the space in terms of knowledge available to people. We spoke about quality of care. We also spoke about that came out. We also spoke about human resources for health. Yeah. So the communique will be shared broadly later today. I know.
We're hoping to get that.
Yes. Then we can also dissect that and talk about it. And also, the Honorable Minister for Health has also articulated his agenda. It appeared he was in the meeting, thank God. So it's a good one for us and for Nigeria. I think it's time for Nigeria, and everybody needs to be on board.
So I think that's the way to stop the program. It's the time for Nigerians to achieve health prosperity. We're hoping that communique comes out later on, and of course, we will invite you so we can dissect it and see how it benefits Nigerians in general. Unfortunately, we've come to the end of the segment, so we have to cut you. But it's been interesting and enlightening talking to you. We've been speaking with Dr. Ufuoma Omo-Obi. He's the Regional Director, West Central Africa Options Consultancy Services. Many thanks for being on ASO Morning.
Thank you very much for having me.
Great. And then that's how we call it a wrap on the program today. But of course, we're going to be here tomorrow. Looking forward to sharing our morning hours with you. And of course, you can follow our programs on all our social media handles. It's airing live, so do be a part of it. I am Ifunanya Yvonne Amafili.
And I am Joy Asoye. Thank you so much for being part of the program. We'll be back tomorrow with so much more. Have a productive day.